Hello, hello everyone. Thanks for joining us for another Ask Kira live studio session. My name's Joan, pronouns are she and her, and I'm a student recruitment officer at Memorial University. Today with us we have Terry Genge and Gina Stacy from the School of Pharmacy who are joining us to answer all of your questions you have about their undergraduate programs. Before I get started, I just have a couple of housekeeping items to go over. So this session is being recorded. If you're participating, you are consenting to that. Your mics are muted and your camera is turned off. So it's going to look like you're here as an only participant, but really you're here with others. Don't worry. You're just going to see only the panelists' cameras today. That's just so we can easily facilitate the session, reduce that bandwidth to be as accessible as possible, but please submit any questions you might have using the question and answer feature to all panelists within the WebEx platform. That's super important to use that specific setting so that we all get to see those questions coming in. Today's focus, of course, is the School of Pharmacy, so we're going to try and keep our questions related to them. And if you have a question you get asked and we don't get to it during the session, don't worry. You will be followed up with either in a direct message or after the session in an email. All right, so to get us started, I'm going to ask if you folks can tell us a little about yourselves and your roles within the School of Pharmacy. Terry, I have you on my screen there first. Would you like to start us off?
Sure, thank you, Joan. My name is Terry Genge. I'm a faculty member at the School of Pharmacy, and I'm a pharmacist. So I graduated from Munn School of Pharmacy in 2004, and then I completed my Doctor of Pharmacy, or PharmD, from Idaho State University in 2013. My background in terms of practice is in community pharmacy. I teach in pharmacy practice and pharmacotherapy at the School of Pharmacy, and I'm also a clinic pharmacist at the School of Pharmacy. We have our own medication therapy services clinic, and I see clients there and I help them quit smoking, which is one of the things I really enjoy doing. And I'm chair of the recruitment committee at the School of Pharmacy, which I guess puts me in the position to do these types of things, which I really enjoy promoting our program to prospective pharmacy students.
Great, thanks for joining us, Terry. And Gina?
Hi, my name is Gina Stacy. I'm a second-year pharmacy student at Memorial University. So I started last year, got admitted to the program in 2019. And this year I'm class rep for my 2024 graduating class. And I'm also the charity representative for the Memorial University Pharmacy Society. I currently work in a nursing home services pharmacy with Lawton's, so Lawton's Nursing Home Services, and that allows me to get a lot of different experiences with not only learning things that are involved with school, but also getting to talk to doctors and nurses. So a lot of that collaborative practice that we'll deal with a lot when we get out as pharmacists. So that's really exciting as well.
Awesome. Thanks for joining us as well, Gina. All right, so just to give you a reminder and get us started there, we're using the question and answer feature to all panelists within the WebEx platform to submit those questions. We really want to get through them, so make sure you start entering those in soon. And so our first question we have that came in is about what types of degree program options you have within the School of Pharmacy. Terry, can you weigh in on that for us?
Sure thing. So at the School of Pharmacy, we have an entry to practice Doctor of Pharmacy program, and you'll probably hear me refer to it as the PharmD program. And the PharmD program is not a direct entry from high school, so it requires some prerequisite courses and a 1 year in university prior to admission. It's 5 years in length, and it includes some practice experience during that time frame. So there's 44 weeks of practice experience in hospital and community settings, and 14 weeks will be done during the first 4 years. And the final year of the program is all rotation, so 30 weeks of rotation. So that kind of just sums up our, I guess, Doctor of Pharmacy program.
Awesome. And our next question we have is for Gina. Students wondering, what does a day in the life of a student look like in your program?
A day in the life of a student in a pharmacy program can be really hectic. Obviously, you're in a full-time course load, which usually ranges anywhere from 4 to 6 courses per semester, which can be a lot. So it requires a lot of in-class time, a lot of lab time, and then obviously a lot of studying after class. But there's so much more to being a pharmacy student than just the schoolwork. There's always events that the school puts off for like all the students of all the years to get together and mingle and just have fun and be able to forget about, your studies for a little while. There's so many committees that you can get involved in, which allows you to meet pharmacy students across the country as well as people in the other year of your program. So if you really get fully involved within the school, a day could look like anywhere from classes to studying to meetings such as this one. It's just everything. You can get involved in everything.
So it sounds like it's super busy, the life of a pharmacy student for sure. And Gina, another question is, how do you go about balancing the work-life balance if that's the case in pharmacy?
Um, I'm not gonna lie. I mean, it can always be a little bit difficult just where there is so much on the go, but it's really all about prioritizing. Like, obviously, if you've got a lot of tests coming up, then school is gonna have to take your number one priority. But there's gonna be a lot of down weeks where you're just gonna have like little assignments and regular coursework to do. So then those are the weeks that you can really get involved in other stuff. So you can get yourself involved in committees that are low work, so usually only require a couple hours a week that you can manage to work into your schedule. And working in a pharmacy is very reasonable because most pharmacies will allow you to do just one shift a week, which is very well to fit into your schedule. So as long as you plan everything out, and like I like to have a to-do list to make sure that I know everything that's going on for every week and that I can make sure I allot time for everything so that nothing gets left on the back burner and you get to get the full experience.
Okay, so planning, scheduling, making those to-do lists, keeping the calendar up to date, all of those great things to keep on top of for sure. Our next question, a student is wondering, they heard that it's super competitive to get into pharmacy, particularly our program. How high does my average need to be in order to get in? Terry, can you speak to that?
Sure. That's actually a great question, and I'm glad that was asked because there's a big misconception out there. I think that students need a 90 average in order to get into our program. Now, our program is competitive and grades are important, but somewhere around, the 75% average would probably be an appropriate or an acceptable grade to get into the School of Pharmacy.
Awesome. And can you explain, a student's wondering how the Casper test works. I understand that's a part of your admission requirements. How much does this test weigh when you are looking at your applications and getting accepted?
Okay, so the Casper test is something kind of fairly recently that we've added to the admissions process. And this test looks at, I guess, non-academic traits. So it's an online written assessment test that does it's a situational judgment test. And it looks at interpersonal skills like, communication and empathy and professionalism. And we do include that, but it's not, it's kind of just we look at the score and we would weed students out based on if they had a really, really low score. And, we would kind of assume they probably don't have the traits, appropriate for our program or for a future pharmacist. So it's not weighed, I guess, heavily in calculating an overall score, an academic score, but it is looked at, I guess, when we first look at the list for admission to see what those scores are. So that's the best I can give for that answer right now. I mean, if additional details are needed, I could probably follow up with that.
Perfect. Thanks for that, Terry. And our next question is a student wondering if it's necessary to have experience working in pharmacy prior to applying. Would that help students?
I think it may help just to kind of, they certainly would get an overview of the expectations in that particular practice setting if it's in a community pharmacy, but it's certainly not necessary to have prior experience, but it could be helpful. I'm just thinking, if you're volunteering in a pharmacy, the expectations, it certainly could help with a student's probably admissions interview.
Yeah.
I don't know if Gina has anything to add there because that.
Yeah, so I actually did work in a pharmacy before I applied, and that's actually where I decided that I wanted to do pharmacy. So definitely working in a pharmacy gave me not only a lot of idea of what I wanted to do, but also gave me like that firsthand experience of like what pharmacists actually do in the real world. So it makes it a lot easier to look at it that way and go, yeah, okay, this is something I can see myself doing. And it gave me a lot of help in first year, like just learning the ins and outs of like how things work in pharmacy. Like I had a lot of advantages there, and it allowed me to make a lot of friends really early on because I was able to help out those people who hadn't worked. So it is like a really good asset, but again, it's not a necessity to get in, and you'll learn everything you need to know in the first couple of years of your program to like catch up with those who had work if it's not something that you've considered.
Okay, good to know. Awesome. All right, moving on to our next question. Students wondering what your interview process looks like.
Okay, so I can kind of go through, I guess, the admissions to get to the interview. So students typically apply, and our deadline is February 1st. So I just want to put that out there. And typically from the applications, like I said, the Casper test is taken into consideration. We calculate an academic score, and then we have two applicant pools. So we have a Newfoundland applicant pool and an out-of-province applicant pool. And we rank the students based on their academic score, and then they are invited for an interview. So our interviews are behavioral based. So basically, they look at what you have done in the past and how you've behaved or how you responded in certain situations, and that will likely infer how you would behave in the future. So questions like, tell me about a time when you did this, what did you do? And, I guess the interview is looking for traits, I guess, characteristics that would be desirable in a pharmacist. So that is typically, I guess, the process. And typically there's a faculty member and some practicing pharmacists on that panel. So there are three interviewers, and interview is about 45 minutes. And, we calculate, I guess, the score based on those questions, and that's taken into account for the overall score along with the academic score.
Okay. Gina, if you want, would you be able to speak to what you felt like on your interview day?
Yeah, so my interview day was definitely one of the more stressful days that I've ever had. I'm not gonna lie, just because like you always know like kind of where you stand academically. Like for me, I knew that I was gonna have a decent entrance average going in. So it was more so like, okay, I need to get through this interview and do well on this interview for a chance to get into the program. One of the things that I found most intimidating was that they don't always give you an indication of how well you're doing when you're interviewing because they don't want you to know like either way. So that can be really intimidating because no smiles can make you feel like you're doing terrible. So for anyone who is going to interview, just know that's not always the case. And that, yeah, like even though it's stressful, the time goes by really fast. You get a chance to tell a lot of your personal experiences on when you've had, good ethical situations or when you work well as a team. And so it kind of gives you that opportunity to show who you are and why you feel you'd be a good pharmacist. And I mean, for the most part, like nobody ever does as bad on their interview as what they think they did. So that's something to look forward to anyway.
Perfect. Thanks for that, Gina. So we have another question. This one's about students who are older than average. So do you ever have older students in your program, older than 30, say?
Yes, we have a variety of a mix of students in our program. So often we'll have students sometimes that have degrees, they may have their masters, they may be deciding to do pharmacy later in life. And we have, younger as well, just kind of doing that first year of university and applying directly after that first year. So I would say probably we have more of the students doing their first year and applying, but certainly we do have students greater than 30. We've had students in their 40s. We've even had students probably 50. So, age is not a limiting factor for sure.
Awesome. All right, and this one's for Gina. Would you say there's anything that you did in your first year that really helped prepare you for the pharmacy program?
So like my first year of one, like before I got in.
Before you got in, yeah.
Yeah. Well, obviously, like taking those necessary prerequisite courses was really important. Like that's why I ended up having to do 2 general years because I didn't know that I wanted to do pharmacy right off the bat. And so when it came time for it, I didn't have all the necessary courses that I needed to apply the first year. So I had to go back and do a second year. So just like being aware, like of all the different options that are out there and kind of taking prerequisite courses that if you like once you do decide what you want to get into, like hopefully you have those prerequisite courses like already done, like the basic sciences, maths, englishes are like a good ones to start with, just because those give you like a very broad array of things you can apply for then once you finish your first year. But other than that, like it's pretty much getting in is very school focused. Like obviously, you have to work hard for that high average, you have to study for your interview, but then once you're in there, it's like all that weight just kind of goes away because you're in. And so I don't really know what else I would have done in my first year to prepare other than, again, just making sure that I had the correct courses and that I just worked really hard to get my average up there so that I could have the best chance of getting in.
Awesome. Thanks for that. And folks, just to remind you, if you're joining us partway through, we're using the question and answer feature to all panelists in order to submit those questions. We'd love to keep seeing them. Next question is for Terry. Students wondering why they should pick our School of Pharmacy at Memorial.
Okay, I love this question. So our program at Memorial, we have a high quality program and we can offer individual attention. We have the smallest, I guess, pharmacy school in Canada. Our class sizes are, really small. So we take in 40 students each year. So I remember teaching first year students, and by the end of the program, I knew everybody by name. So it's a very welcoming, supportive learning environment. We have open door policies. We care about student success. And we're a very I think we're a very friendly bunch. So, the tuition is affordable. We are situated in a hospital along with nursing students and medical students, so there can be some collaboration there. We have our own pharmacist clinic on site, which is what I've mentioned earlier, and our students get the opportunity to, interact with real patients via our clinic, and they can do some clinical rotations at the MTS clinic as well. So, we have lots of, I think, benefits to our School of Pharmacy at Memorial University.
Awesome. Sounds like a lot of reasons to choose us for sure. Our next question is about the pharmacy program and how its entry to practice doctoral program. Why is that now a doctoral program?
Okay, so you're right. So previously we did have a Bachelor of Science in Pharmacy, and we converted to an Entry to Practice PharmD program. We took in our first students in 2017, and The reason for the change is that the scope of practice for pharmacy is changing. So not only, I mean, 15 to 20 years ago, pharmacists were seen mainly as being behind a counter in a dispensary, dispensing medications. They had more of a technical role. Nowadays, we have pharmacy assistants, we have pharmacy technicians to do that, and pharmacists have the ability to interact more with patients to help them manage their medications and interact with other health professionals. Pharmacists today do so much. We can administer injections, we can prescribe for minor ailments, we can do complex medication reviews and collaborate and prescribe for smoking cessation. There's just so much that pharmacists do now, and our scope is evolving and changing all of the time. So we needed to develop a program that would suit those needs of future pharmacists practicing. So, and that's the reason why the change occurred, of course.
Wow, you really do a lot as a pharmacist, hey?
Yeah, a lot more than you'd think. When I was back in, first year or in high school, I just thought pharmacists counted pills. I didn't know really the role of a pharmacist.
Yeah, for sure. And so it's ever evolving and changing and expanding. So it makes sense that that program got boosted from a bachelor's to a doctoral program. Um, Another student is wondering if there are any clinical rotations that offer paid opportunities for students.
So the clinical rotations that pharmacists do as part of the program?
Yeah.
Okay. So no, like as part of the program, the positions are not paid. They're part of the education part. However, students often in our program seek part-time employment with pharmacies. And many students, even after their first year, are employed in pharmacies on a part-time basis. And, that they can get paid for those rotations, I guess, or that work.
Okay, so they can kind of seek that out
Yes.
outside of the program. Perfect. Alrighty. And all right, folks, so we're coming to the end of our session now today. Do you have any extra tips or tricks for our incoming prospective students that we have online with us today?
Yeah, just like some little tips and tricks for if you are considering applying to pharmacy, obviously, I would highly recommend it. It's such a fun program. We have such a great Memorial in itself has such a great pharmacy program. Like Terry referenced earlier, the small class sizes really make you feel like a family there instead of just a number. So I really enjoy being a pharmacy student. Just if that's really what you think you want to do, then you want to really look into your options. Like, again, make sure you have all those prerequisite courses done. Make sure you strive for, the highest average that's reasonable for you to give you the best chance of getting in. But mostly, like, just have fun with it because your 5 years are going to fly. And if you do get in, like, you want to take the most experiences that you can to have the best school experience that you can have because when you graduate, like, that's what you're going to want to look back on.
And I just want to add that, future students thinking about coming in, I think pharmacy is an excellent career choice. And there's endless opportunities, for work after. We have 100% employment rate. There's so many different areas in which a pharmacist can work. And, a lot of students, like I said, when I was back in your shoes, I probably thought, of a pharmacist just working at Shoppers Drug Mart, dispensing medications, but there's so many career opportunities. There's hospital, there's, academia, working in pharmaceutical industry, working in government, working with pharmacy associations. Like the opportunities are endless. And, I think it's just a very exciting career choice for sure.
Great. So I'm going to thank everybody so much for joining us today. Thanks, Terry, Gina, and all of our attendees. If you have any other questions at all, feel free to email us at admissions@mun.ca. If you want to stay connected with us, you can certainly fill out our request for information form on the front page of our website, mun.ca/undergrad. And also be sure to check out our next session with the Faculty of Science on Tuesday, November 24th at 4 p.m. Newfoundland time. All right, folks, thanks so much. Take good care.